The diet claim that I'll be critiquing today is the modified Atkins diet. The modified Atkins diet claims to have efficacy in patients with intractable epilepsy. Some of the key points that we'll be covering is the fewer serious adverse health effects on the body, fewer diet barriers or restrictions when compared to alternatives, and lower hospital costs or no need for hospitalization with modified Atkins diet. That was the initial claim. The overall purpose of this diet is to provide another alternative to dieting patients with intractable epilepsy by providing a diet with less side effects and restrictions that yield similar results to the alternatives. Also, the MAD diet or the modified Atkins diet helps reduce the frequency of seizures in patients who are resistant to medication by providing an easier to follow diet than what has traditionally been used, a ketogenic diet. The first point I'll be touching on is the fewer diet barriers or restrictions when compared to alternatives. The modified Atkins diet was initially a less restrictive ketogenic diet. This made the diet easier to follow for families that had been dieting for epilepsy, easier to maintain long term, and more cost effective. All studies that used the modified Atkins diet in research concluded that a significant amount of the patients in the study followed the modified Atkins diet fairly well. Some of the patients, with each varying in the amount that followed, said that the modified Atkins diet was too restrictive, thus discontinuing the diet. From reading people's personal review of this diet, many said they had the ability to go in and eat at a restaurant that they previously could not enjoy because of the restrictiveness of the ketogenic diet. The next point I'll be talking about is the fewer serious adverse health effects on the body. Throughout three of the four studies, some patients did have minor health effects such as nausea, vomiting, and loss of appetite. Only one study did not touch base on these health effects. Overall, these were somewhat small reactions to the sheer number of patients that were within the studies. These side effects did lead to those patients discontinuing the diet. This aspect gets a thumbs middle because of the side effects that these patients were experiencing in their diet and the negative effects that it had, and it leading ultimately to them discontinuing the diet if they experience these side effects. The final of the initial key 3 points was the lower hospital cost or no need for hospitalization with a modified Atkins diet. With the overall less side effects, there is less need for hospitalization. Also, with the effectiveness of the diet, there's less frequencies of seizures, also leading to less hospital visits. This point is very helpful for families and patients that cannot afford or struggle to have the ability for less hospital visits, making it one, more effective cost wise, and more effective for those patients in the diet. This is a very helpful point in showing why this is a good option for patients with intractable epilepsy. The overall results from all of the research studies each concluded these 3 points: easement in adhering to the diet, the effectiveness in reducing the amount of seizures, and the less restrictive in the overall following of the diet. The modified Atkins diet does not follow general dietary guidelines or MyPlate recommendations because of the significant carbohydrate restriction in the diet. With all of these trials concluding similar results and the overall positive points being very significant compared to the negatives, I would recommend this to a patient or client that had intractable epilepsy. This is because of the sheer amount of positives seen from research and people's personal experience that I had watched and read on the modified Atkins diet. I give this diet a thumbs up and its claims for patients with intractable epilepsy and the overall positives that it provides.